It's good. Okay, perfect. We have attendees joining us on Zoom now. So we'll give people a few minutes to join, and then we'll go ahead and get started with this evening's talk. For those of you on Zoom, thank you for joining us. We've had a great turnout in person, which is very exciting. We're happy to welcome everyone to our new building at the Equine Park. This evening, we're going to focus on a couple of things that happen here. There's a lot of stuff that happens at this facility. We're going to focus on discovery, so research, equine health-related research, care, some of the layup care options available here at the park, and then the breeding program and the reproduction service, which runs out of the Equine Park. Dr. Donnelly is up here now. You guys probably, those of you that join the seminars on Zoom, likely recognize him as well. He's involved with the planning and is in the repro service here, so spends a lot of time here at the Equine Park. Essentially, he lives here. This is his second home. How are we doing on Zoom? We've got a fair number of attendees. Okay, we'll go ahead and get started. So again, just kind of a breakdown of our talk this evening. We will talk a little bit about the history of the park. Like we've mentioned in some of our in-person discussion, the park has changed a lot in its appearance over the years. If you guys look up, for those of you in the classroom, you'll see some old wood beams along the ceiling. There's another one out front. These are actually from one of the older barns that was recently demolished prior to the building of this barn. So a lot of the history is instilled within this new building. We'll talk about and highlight some of the research projects that are going on at the equine hospital and by the clinicians there and other team members there. What the park has to offer in terms of layup care for recovery from various injuries, post-op care following surgery, and horses that are sick with various illnesses. And then Dr. Donnelly will focus again on breeding the next generation of equine athletes. The park, when you guys were driving in, those of you that attended in person tonight, you may have seen some horses turned out in the pastures along the drive. Many of those horses are part of the teaching herd, so they help teach the veterinary students, some veterinary technician students as well, and they're really a valued herd within the Cornell equine program. We have many of the equine team members here this evening. So photos of everyone that you may see giving tours this evening. I've pointed out a few of these people already. I also want to mention Dr. Jillian Perkins. Dr. Perkins was recently appointed as the faculty director of the Equine Park, and she's also the equine hospital director, so a valued team member for us. And I think she'll likely be joining us this evening at some point. I'll let Dr. Donnelly take over now to talk a bit more about the history of the park, as he knows it much better than I do.
Thank you. Welcome, everyone. I really enjoy getting to show people around the new facility, but I really like to talk about the park. It's been a really big part of my career. I've been involved with the Equine Park since 2012. I actually visited here as a student extern from Australia. I stayed in the dorm house just down the way there. A kitten had a litter of kittens under my bed. I got the full park experience while I was here. The thing that I really love about the park is this continuation of the history of this place and how it has been a different entity for the different needs of our equine patients. So truthfully, this started as a nutrition, pharmacology, and breeding research facility, very much tied to the standardbred racing industry. If you see outside here, we still have a track. We refer to that pasture inside there as the infield still. Occasionally we'll use it, but it's really much out of commission from what it was previously. As Dr. Knickelbein indicated, this building sort of both symbolizes the new, but carries a little bit of our history in that it has the beams from our historic bank barn. And I think a lot of people that have horses in New York would be pretty used to bank barns being converted into horse barns. And we worked out of that facility for a number of years, and that was where we primarily foaled out our mares, both the park breeding herd and then also our own mares. The park breeding program is also, and I'll talk about that a little bit more later, has gone through a number of iterations. again, we were tied with the standardbred industry. We've had impacts on the thoroughbred industry, and most recently, we're, I think, an existing name in warm blood breeding of sport horses. As a separate part of the park sort of represents one facility amongst a cluster of facilities here that look after horse health interests, and the other part of that would be the contagious equine metritis quarantine facility, which is on the other side of campus, but is part of the wider park effort. That facility has been shuttered with the sort of change in the nature of monitoring for that disease and the distribution of decentralized quarantine facilities. What we have today, we have this beautiful new building that was many years in the making and was commissioned officially late last year after a 2-year building time. This building was made possible with the support of the state of New York, and as a way of bringing forward all of those separate equine facilities into one place. So now we have both a teaching laboratory and then importantly, conditions space for the people that are really important out here that run this operation. We'll show you through the barns this afternoon or this evening. We have 28 stalls here that sort of adds to our existing footprint. Like I was mentioning, this place doesn't run, but for the people that are really passionate about running it here, and that's the dedicated Equine Park staff. So this is Jess Crum. She leads the team out here. There's a few people missing from this group of people. The other thing to say is that most of the people that work here have been working here for a long time. Alexa has been here for 25 years, and she's one of the shortest tenures at the park. So people really do spend their life careers here in the interest of horse health, well-being, and a lot of the other stuff that we're able to do out here. I'm going to hand it back over to Dr. Knickelbein.
Alrighty, I think my mic is on. Can you guys hear me okay? Okay, perfect. Want to take some time to just highlight some of the active research projects that are ongoing at Cornell. Many of these projects involve horses here at the park or take place here at the park or involve park resources. So just so you guys have some idea about the breadth of equine health discovery that's occurring within the College of Veterinary Medicine. Have broken this down into kind of loose subjects. So medicine and performance, highlighting work by Dr. Ciccone and Dr. Del Vescovo, both of whom are here this evening. Dr. Ciccone is working on a celiac plexus block for the treatment of paralytic ileus or slow GI function. And this is a really, really cool technique to advance the management of colic, the non-surgical, and potentially, to use alongside surgical management of colic, which we all know is terrifying. Colic is terrifying in horses. Evaluation of poor performance using the high-speed treadmill, another project from Dr. Ciccone. And then also the pathophysiology of recurrent laryngeal neuropathy with a focus on designing biologic treatments for this condition, known commonly as roaring, common in racehorses, thoroughbreds, and other breeds. So a really prevalent problem that Dr. Ciccone is working on trying to identify some solid treatment options for. Dr. Del Vescovo and others are working on the pharmacokinetics of ursodiol in foals. Ursodiol is a relatively commonly used treatment for liver disease. The drug has not been utilized frequently in foals, and so working out the dose, how it is metabolized, that kind of thing is the focus of that project. And then also the validation of a handheld creatinine measurement device in foals. So this is a stall side test, really simple and quick to run, and it assesses kidney function, which is really critical in horses, particularly in foals who are very prone to insults to their kidney function. Dr. Donnelly can answer questions about the repro-related projects that he's working on, mainly focusing on insulin regulation during pregnancy and on a wider scale, metabolic syndrome and how it affects reproduction. So metabolic syndrome is really common in horses, particularly common in horses as they age, and can be quite prevalent in some horses that are being used for breeding purposes, mares and stallions alike. Dr. Beth Williams is a PhD student, excuse me, in the lab of Dr. Kath Mitchell, and they're working on many projects to kind of better categorize equine cardiac function in both health and disease. And this is true in both adults and in foals. So we have a great population of foals who you guys will get to meet this evening that serve as the basis for establishing kind of normal function and normal parameters of the heart as it develops, both in utero and as they develop once they're born. They're also investigating the use of a drug called doxapram to treat both acute, so short-term, and more chronic, long-term atrial fibrillation, which is an arrhythmia that's relatively common in horses. And then also investigating mitral valve prolapse, which causes a heart murmur, and risk factors associated with that murmur for arrhythmias. So really, really important work. Arrhythmias are thought to be a common cause of sudden cardiac death in horses. So this is vital work, not just for race horses, which I think we all kind of hear about potentially being, succumbing to sudden cardiac death, but horses in all disciplines, even our, pasture horses can be prone to these types of things. So important work there. Dr. Alexa Wright, who's here this evening as well, one of our dentistry and oral surgery specialists. She is working on tooth resorption in horses, so quite common in aged horses, and investigating some different environmental exposures that can predispose horses to tooth resorption. She's also developing some minimally invasive maxillofacial surgical techniques for the horse, which is really cool. A lot of this stuff, a lot of what Alexa does can be done in standing sedated horses, which is awesome, safer for the horse. Hard work for her, but again, safer for the horse, better for the horse overall. A couple projects associated with our surgery team, our anesthesia team, and our imaging team, most of these led by Dr. Amy Colbath. She's looking at the effects of oral trazodone, which is an oral sedative that's increasingly utilized in horses for various reasons, but pretty common for post-operative care. Horses that need to be on prolonged stall rest, this drug can really help them to be settled when they're used to being out, when they're recovering from an injury or a surgery. So investigating the effects of this drug on platelet function. In a few other species, the drug is known to impact platelet function, and that hasn't been yet investigated in horses, so she's looking into that. Looking at different anesthetic techniques for treatment of pain in horses, so specifically looking at an epidural local anesthetic for the treatment of hind limb pain. And that project is in association with Dr. Jordan Besh, who's pictured here. She's one of our board-certified anesthesiologists. Dr. Colbath and Dr. Amy Todd Donato pictured here. Dr. Todd Donato is one of our imaging specialists, so a board-certified radiologist. They're looking at the treatment of meniscal injuries in horses, so that's a structure in the stifle, what we refer to in ourselves as the knee, not the knee of the horse. Treatment of meniscal injuries with mesenchymal stem cells, and they're monitoring those in various ways, but imaging with ultrasound and other imaging modalities is an important part of that project. And then Dr. Colbath is also looking into mast cells as a potential target for treating equine osteoarthritis. Some of the work that I've been doing since starting at Cornell has involved the horses here. This horse pictured here is Waterford, one of our stallions. So he's used for some advanced imaging projects of the equine eye. We do a few different things, high frequency ultrasound, which is pictured on the left of the bottom of the screen there. So really high frequency ultrasound allows us to see some of the structures in the front half of the eye that we can't see with our other instrumentation, like our handheld microscope. So allows us to determine some of the detailed structures there. We have also started to utilize some of the advanced imaging technology that's considered very routine in physician ophthalmology. If any of you see an ophthalmologist, if they're monitoring you for retinal disease, a big component of your exam is going to be the imaging that they do. They're, of course, going to look at your eye as well, but they base a lot of their interpretation of response to treatment, progression of disease off of imaging. And we're kind of just getting to that point where we're able to apply those same technologies to horses and really importantly, to standing horses. So we don't have to put them under general anesthesia to get really high resolution imaging of their retina. An example of that on the bottom right here. So this is optical coherence tomography of the retina, which we've done in a standing sedated horse. Um, Also looking into some various treatment options for corneal disease, specifically photodynamic therapy. And then along with Dr. McConey, who's one of our equine surgeons, we are looking into the applications of orbital endoscopy to diagnose disease within the equine orbit or disease that occurs behind the eye, which is relatively common in older horses. Want to highlight that a lot of the work that was just mentioned is funded by various different sources, some within Cornell, so internal funding within Cornell, mainly the ZWAG Fund, which provides generous research funds for people to carry out work that really does advance the health of the horse. We also have a lot of external funding through various entities listed here. So some of the ophthalmology research is funded by the American College of Veterinary Ophthalmology Vision for Animals Foundation. The AAP Foundation for the Horse funds some of the work mentioned, and then also the Grayson Jockey Club Research Foundation. Takes a lot of effort and time for researchers to obtain funding. Writing grants is very time consuming. And requires quite a bit of skill. So a lot of effort and time is put in on the researcher's part to obtain this money, and then also a lot of dedication and devotion to be able to complete these projects. So just want to kind of highlight the work that everyone puts into this to try and improve the health of horses across disciplines. Okay, any questions on what we've discussed so far, history of the park and the highlighted projects? We'll mention a kind of different application of the park now, which is that it does serve as a layup facility. It's really nice for us as clinicians over at the equine hospital to know that we have this as an option for kind of step down care. Once we have patients that no longer require hospitalization, we don't need to have eyes on them, every single day, examine them every single day. And once they're on a medication plan that's a little bit more flexible, less intense, layup care is a really good option. And we're super close to the equine hospital, so we feel good about the fact that if something does come up with one of our patients who's laying up over here, we can either get here quickly or else the park staff can transport the horse back to the clinic quickly so we can assess things. So what's involved in layup care? Usually medication administration that can range from oral medications to eye medications, most commonly. Monitoring of the patient, so your general monitoring, are they eating, are they passing manure, but also monitoring of comfort level. So for me, I obviously treat a lot of eye disease. The park staff have become very skilled at monitoring patients with eye disease to know, yeah, they're looking good, their eyes open, or actually this patient's squinting a lot more than they were yesterday. I'm going to let Dr. Knickelbein know about that. They also have the ability to provide opportunities for daily exercise. So depending on why the patient is here, they may just be hand walking, or they may be able to have, time in a small turnout. We'll show you guys all the turnout options here as well. Of course, it includes board, so the stall, feeding, daily grooming as well. Dr. Donnelly mentioned he used to live here, as did one of our audience members. So there are staff on site 24/7 for that kind of peace of mind. There is someone here. There's a late night check. People are around all the time. And again, we're super close to the equine hospital. So it's good to know that if anything comes up, we're close by. I send a lot of cases over here for layup care. Eye disease can progress really rapidly, and then it takes a long time for eyes to heal. I'm often recommending horses are treated with multiple eye medications up to 4 times daily for up to 3 to 4 weeks, and that's really overwhelming for a lot of people who have their horses at home or board at a facility where that's just not feasible for them. And so having the ability to send horses here for that care is great for me, it's great for owners, and it's good for the park staff too, to be able to provide those treatments. Other services use the park for layup as well, so orthopedics, so musculoskeletal injuries or musculoskeletal surgery cases, soft tissue surgery cases, dentistry cases, and medicine as well. And then just to mention this. We are restricted in the cases that we can send over and that they should not have any infectious disease. Obviously, we've mentioned we have a large herd of teaching and research horses here who we need to keep safe. And so we are restricted to horses that do not have infectious disease. Just a little bit more detail about some of the ophthalmology cases. So some of the diseases we see that might come here for layup: corneal ulcers, stromal abscesses. So a stromal abscess describes an infection of the cornea. Post-op cases that have had corneal surgery or cataract surgery, and then some uveitis cases that they have really severe uveitis. Their management may include really frequent application of medications. They're often painful, and so we may be managing them with a subpalpebral lavage catheter. The horse pictured here has kind of all the gear on. So this horse was here during the winter. He has a subpalpebral lavage catheter, which allows for administration of eye medications to the eye without having to manipulate the eyelids. He has a sleazy on to keep that SPL in place, and then he has a protective eye mask on as well. The park staff are able to medicate up to 4 times daily. They also are able to monitor the SPL catheters. They can be somewhat challenging if you haven't used them before to know when there's a problem, to know if the medications are getting in. So they provide really good care with that. They also are able to check the protective eye mask, clean it, replace it, reset it, that kind of thing. And then, of course, providing oral medications, hand walking, turnout. And I like to come over here to do rechecks. It saves the horse having to ship back to the clinic for its recheck. And generally, I'm over here at least once a week to look at patients on layup. Just some examples of orthopedics cases that may end up here. So arthroscopy, which is where a scope is placed into a joint, can be indicated for various reasons. Horses that have had fracture repair, horses that have had other minimally invasive surgeries, horses that have had injuries that are receiving serial treatment with orthobiologics or serial shockwave therapy, may be good candidates for layup. Wound management is another big one. Sometimes these chronic wounds require a lot of care and can take a really, really long time before they're stable enough to not require as much care. So they're good candidates for layup as well. We have, you guys again will see the various turnout options that we have. You may have also noticed the track here. The track isn't utilized a ton right now, but it is utilized occasionally by our surgeons to do dynamic endoscopies, so to look at horses' upper airways as they are actually moving. So a neat application there. And then a really nice thing again is our proximity to the equine hospital. Owners will often ask, do I need to come trailer my horse from the hospital to the park? And the answer is no. The park staff are kind of constantly going back and forth from here to the hospital. They have a nice, really safe stock trailer. They're able to get almost any horse on the trailer, even if they're difficult to load. And so we have the option to quickly transport them back and forth for a very small fee. Alrighty, I'll let Dr. Donnelly take back over and talk about repro.
Thank you. I'm going to show a few different things here. One is going to be about what the park as a whole and our efforts towards our breeding program, and then what the reproductive medicine service offers here for breeding of both our park horses as part of our teaching effort, and then also what we're able to offer to clients. Tonight, when we're out in the barn, if you have any questions about our mares and foals, please feel free to ask me. I'm more than happy to show them off. These are some of the babies that we've delivered here this spring already. Most of our foals are already on the ground and are, a month or 6 weeks old at this point. The breeding program here, I alluded to it before, has sort of moved over the years. And we're very lucky now that we have an established group of broodmares here, and then we predominantly breed warm blood sport horses. That program was really, I think, put in a good place by a previous manager out here, Carol Collier, who spent a long time cultivating relationships with people in the industry. And so we have something that is, I think, fairly hard to get and something that's even harder to keep a hold of, and that's a good reputation of producing really good sport horses at a fairly reasonable price. and then also providing a really good home for broodmares that may not have many options out there commercially, whether they're a little bit subfertile, or have had injuries that are harder to manage. We're able to take on some of those mares. And so at the moment, we have a really flush, nice group of mares that we're working with. As far as what we are able to do out here, and we'll show you as we go to part of the tour, our labs and then our clinical areas. We sort of break it into the two areas of our clinical practice. One would be our routine care. So these are reproductive medicine cases that are not necessarily referral level, but are things that are more easily managed at a center like this. And the sort of cores of that are our foaling program, and we'll show you our foaling stalls. And that's been the biggest improvement of this facility, sort of moving up from that old bank barn up into here with a more modern foaling facility. That's a program that has been running for decades now, and it's been a sort of like key part of our place in the equine community in this area, is providing that as a service. Stallion training for outside stallions. We're right in the middle of the breeding season at the moment, so on any given day of the week, not today, but in general, I have a sort of parade of stallions that are coming through here for training, for workup, for management of various conditions. Again, that would sort of be part of our more routine care. But truthfully, there are not very many facilities in New York or just this part of the world that will handle stallions on a regular basis. And then broodmare management. So sort of routine breeding here, both to outside stallions and then to our stallions that we stand here. On the advanced care stuff, as a modern reproductive medicine practice, we do sort of offer the full range of assisted reproductive techniques. And so in this age, that means conventional embryo transfer. So removal of embryos from donor mares and then transplanting those embryos in surrogate or recipient mares. We're able to harvest oocytes or eggs and ship them to sort of partner facility laboratories for the sort of horse equivalent of IVF. Something that this service has always tried to maintain, and that is our presence in the hospital, both here, the things that we can offer here and then through the hospital in gynecologic surgery. So that may be things like cervical laceration repairs, doing perineal reconstruction surgery. And then the last thing is our maternal fetal medicine service. So managing high-risk pregnancies, whether that's because of maternal disease or if we have high-risk pregnancy situations like twins, we're able to offer an advanced level of care both between here and the hospital. Just highlighting the team that I have here, I'm very lucky to train a number of talented residents that also thought that it was really good to dress as me on April Fool's Day this year. So we have a long history of training future specialists, and I think that's something that is a really key part of the park, and it's a really big privilege of mine to be able to do still. In addition to our broodmare band that we have here, that we're very lucky to be able to produce foals from, and those foals are used widely. Not just that we produce foals that go on to be sport horses, but those foals are used actively in research. That's a fairly rare thing to have anywhere at the moment. The ability to have foals that are accessible for sampling or for performing, echocardiograms to define some things that have been, really understudied, and it's hard to get a hold of those populations of foals in a university. And so we are trying to maintain that. And one of the ways that we are able to maintain that is that we have our own stallions on the ground, but we also have this battery of stallions in our liquid nitrogen tanks that Carol Collier left us here. So we will show you Waterford. I like to say that Waterford is the other specialist here. He has his own referral caseload of mares and a big following in the area. He doesn't look his age, he's 22, but we have foals in the barn. We're actively breeding mares, outside mares this week to that stallion. And he's been, a fixture here for more than a decade. And so he's as big a part of the park as really any horse that has ever probably walked through here. And like I mentioned, we are able to still access this really high level of horse through what we have in our cryopreserved samples. So this is Juventus, who was a stallion that used to stand here. He's now deceased. We hold all of the semen that exists for him in the world, and we're still producing foals out here that are of really high quality and very competitive dressage horses. So we're really happy to continue that. We do have, I heard someone say that they had Arabians. We have an Arabian teaching stallion out here, Amir, who's really filling in a bit of a gap there that we had for teaching stallions. At our height, we would have had 6 or 10 stallions of our own here. We're sort of at a bit of a low for stallions at the moment, but we should have a new stallion arriving here within the next couple of weeks as well to sort of take us into the next decade. I think probably one of the most important things that we do out here is teach. And the thing that this new facility has really enabled us to do more effectively is teach at all levels. And so we conduct our clinical rotation out here for students that are seeing practice in reproductive medicine. And that has always been the typical thing that has been done at the park. But now we start with earlier vet students and undergraduates. So they're out here doing horse handling, very basic things, learning how to do physical exams, blood draws. Even walking a horse can be a really big thing for someone that is unfamiliar with horses. And so we're bringing that back to the park, whereas it used to be taught at some of the other various equine facilities around the campus. And so we're sort of integrating our teaching within the horse fields a lot more. And so we're seeing a lot more student activity out here, which at this time of year is pretty great. I guess it's still a little bit cold in January, February, March, but at least they can take shelter in here and enjoy the horses. So here's just some examples of the teaching that we're able to do in this barn. So we have some of the more junior years where they're doing their horse handling, they're learning how to put on halters, learning how to do injections, and then our more senior students, they'll be learning procedures like transrectal palpation and ultrasound and how to manage broodmares. And even some of our horses like to participate in the fun. That was the line that I was meant to say here. And I don't say that lightly. We talk to the students all the time about how our horses are really trained teachers and they're very patient. They put up with a lot in as far as how long it may take to do something really, I don't know if the students always realize just how lucky they are that they have 60 or 80 dedicated teachers that are helping them learn how to be around horses. Does anyone have any questions? Both in live and on Zoom.
The answer, maybe internal medicine. What work, if any, is being done on EPM at Cornell?
I can probably speak to that. None.
Specific research. Yeah, and the diagnostic lab.
Yeah, there is an EPM working group within the internal medicine field, but most of those researchers are external to Cornell.
And are your teachers' donations?
Yes, so we are very reliant on the generosity of the equine community, and that's at sort of all different levels. So we provide homes for breeding horses, but we also provide homes for horses that need somewhere to step down from whatever they're doing in their life, or if they need somewhere else to retire. So a good example of that, the new stallion that we're getting is coming from California, and the donator of that stallion chose to send him here because he would be able to live out his days here. And that was very important for her. Doesn't matter that he, may never breed another mare in his life, but he's going to have somewhere good to live. And I think that's something that we try really hard to do here, is provide good long-term care. There are horses here that I like to tell the students were old when I first visited here in 2012 that are still here teaching students. So we do provide that sort of like lifetime care for them. And then, obviously there's end of life things that happen out here all the time, but yeah, we are reliant on donation.
Is the treadmill here as well now? Or is that still, or is it both?
Dr. Ciccone is the expert at the treadmill, but it's at the clinic.
The only. deal. Awesome.
Should we go see some foals?
Yeah. I think we can wrap up the Zoom. Thank you very much to those of you who joined on Zoom this evening. We look forward to seeing you all in the fall, and we'll be emailing in the early fall with our schedule for those seminars. For those of us here this evening, if you look behind you, you can see into the reproduction lab, the